This is OPB. I'm Crystal Ligori. All this week, OPB and other newsrooms in Oregon have been highlighting the public health crisis of death by suicide. It's a project called Breaking the Silence. And it turns out even providers who work with vulnerable populations, people impacted by homelessness, addiction, and poverty, even these providers have to learn how to talk about suicide. OPB's Kate Davidson spoke with Lydia Bartholow about that process. She works with Central City CARN in Portland, which provides a range of services from healthcare to housing.
Your specialty is the intersection of addiction and mental health. What have you observed about the role of addiction when it comes to the risk of suicide?
I often tell providers that when you're doing addiction work, you're doing suicide work. Addictions and suicidal experiences are so common and so intertwined. And there's kind of a couple things that allow those two bodies of work to arise together. I think most importantly is thinking about the ways in which the disease of addiction really engenders an experience of hopelessness and an experience of lack of control. And what we know about suicide is often people don't have experiences that they want to be dead. They have experiences that they no longer want to suffer. They no longer want to be in pain.
So when suicide comes up at Central City CARN, it might come up with a primary care physician or at a housing appointment. How have you talked to providers about how to talk about suicide with vulnerable clients?
One of the primary things that I do is actually helping providers to self-regulate themselves when the topic of suicide comes up. So, for example, if you have a primary care provider who has a 15-minute appointment slot with a patient, and a patient mentions that they're feeling hopeless or suicidal, the provider immediately feels anxious. That anxiety, in turn, shuts down our ability to think clearly and to be present with the other person in the room. And so the bulk of my work is really teaching providers how to manage their own anxiety and their own discomfort around this topic. Of course, we do a lot of training about logistics, how to actually speak the words, what makes people higher risk or lower risk, but the bulk of it is how to be present with people.
You know, part of the idea behind this project, Breaking the Silence, is changing the way that the media talks about suicide, moving away from a tendency to shy away from the subject for fear of a contagion effect to talking about it responsibly. Have you seen or have you worked to create a shift in the way that healthcare providers talk about suicide?
Yeah, recently there's been a sort of national initiative called Zero Suicide. And we've implemented Zero Suicide in the primary care clinic at Central City CARN.
And can you just describe quickly what Zero Suicide is?
Yeah, Zero Suicide, more than anything, is a paradigm shift that says suicide, when someone's engaged in healthcare, is never acceptable, which is a big shift, especially in the behavioral health world. Historically, we have sort of said, well, it's inevitable. We're going to do everything we can, but it's inevitable. And we haven't necessarily engendered systems that try to prevent suicide at all cost. And so one of the things we did is we started thinking about suicide screening just as if it was any other baseline vital in healthcare. So we ask about suicide when we take your blood pressure and when we check your blood glucose. We're screening for suicide at almost every primary care visit, which is a shift in the way that we've done it historically.
As we think about changing the paradigm in how we talk about suicide, are there misconceptions out there that you see about suicide that you would like to change?
So I think one of the misconceptions about suicide is that once people have made up their mind, they've made up their mind, there's nothing you can do about it, which again is what the Zero Suicide paradigm tries to push back on a little bit. And I think what we know about suicide and the experience of suicidality now is that it's often deeply ambivalent. And people who want to end their life don't usually want to experience death. They want to not be in pain. And when people are feeling suicidal and there is a way to break that spell or a way to interrupt the experience, people later report that they are glad that they weren't alone and that there was an interruption.
That was Lydia Bartholow speaking with OPB's Kate Davidson. Bartholow is the medical director for behavioral health at the Blackburn Center in Portland, which is part of Central City Concern. If you or someone you know is contemplating suicide, call for help now. The National Suicide Prevention Hotline is answered by trained staff 24 hours per day. The number is 800-273-8255.